Okay? So you have this with you, and you have this with you. It's in the bag, and you go into the chart. If you look at this PowerPoint page number 9, no, not 9, 7, page 7. So it says gather your equipment. So for the checkoff, you'll be saying all the things that I'm saying, okay? So I'm gonna go to the department. I got the nebulizer, and I'm going to the chart. What am I looking in the chart?
Diagnosis history.
Yeah, we want you guys to tell us this thing, okay? So you're going to look for the order. Order is what is the 3 things you need to see in the order?
Dosage, medication, and
Type of
frequency.
medication.
Type of
And
medications
frequency,
and
we're
the
gonna
free, yeah. And what else you'll be looking? Protocol, history, patient information, like x-rays, lab reports, all different things, and just to see whether this patient is in isolation, or if they are in isolation, what kind of isolation, and vital signs the nurse been doing, and if their heart rate is already high, you will know before you even walk in the room, right? So you have a basic idea of the patient, and you're going in the room. You're knocking on the door and introducing yourself. But how are you going to introduce yourself? How are you going to say it?
Full name, student.
Yeah, just say it. I'm from respiratory. My name is Jeff. I'm here to give you a breathing treatment. And they say, what? Breathing treatment? What is that? How are you going to tell them? How do you explain them what nebulizer is? See? They don't know what a JedNeb is. Medicine to help you with your breathing. And they might say, oh, I have issues with breathing. Who says so? What happened? That's why you needed to look in the chart to see whether there are x-rays and, oh, sir, your chest x-ray looks like you have issues with your lungs. We need to give you these treatments to clear this up. And your doctor thinks you need this treatment, so therefore he ordered this treatment for you. Okay? All right. So you told the patient, and it says wash your hand, apply standard precautions. So that's right before you go in the room. How do you identify the patient? How do you know this is the right patient?
You ask them?
Don't forget.
2 identifications. Yeah, you need to make sure of that. Then what are you going to do? Then you can do the assessment before you assemble your nebulizer. Do your assessment, because if you don't do your assessment, what if their heart rate is 160 and you're not going to do the breathing treatment? You don't need to put together your nebulizer. You can just say, I'm sorry, your heart rate is high. Let me go check with the nurse, or you can go out the room. So, if everything okay, you're going to assess the patient. What are the assessments you're going to do? What are the 3 things you'll be looking for?
Heart rate,
Heart rate.
respiratory rate, and
Breath
flow.
sounds.
Yeah,
Okay.
breath sound.
Okay. If their heart rate is already high and they're complaining of chest pain, what would you do?
No, EKG.
You don't do that. You do not give the treatment, right? You notify the physician or the nurse. And if they are you listen to the patient's really wheezy and their heart rate's already high because of this breathing issue, you may want to go ahead and give the treatment and see whether that helps. Okay. All right, now, what position are you going to put the patient in? Semi-fowlish position or fowlish position. The next step is put together your nebulizer. Make sure you have your gloves on. All right, how do I know this patient needs a mouthpiece or a mask?
Yeah.
If they are unconscious patient, you may want to use a mask. And let's say it's an old grandma, she can't hold a mouthpiece. You may want to use a mask. And if there are restraints on the hand, they can't hold it, so you may want to use a mask. Sometimes you may ask the patient, ma'am, would you like to have a mouthpiece treatment or a mask treatment? And they'll tell you, oh, no, I've been using mask for a long, all these years. I want mask. Some people don't like the mouthpiece. So you ask them. So if you are using a mouthpiece, and you all know how to put these together, right? Okay. The blue tubing goes under. Hook this to the air or oxygen. If it's a COPD patient, you won't want to use the air.
Yeah.
Yeah.
Okay. So you hook it in, open it up, put your medication in it, aseptical procedure, close it up. Now, you instruct the patient before you give it to them. Well, how do you tell them? Ma'am, this is the mouthpiece. Put this mouthpiece in your mouth. I want you to take a nice, breathe normal. Every third breath, you take a nice, slow, deep breath and hold it for 3 to 5 seconds. So they put it in their mouth. They breathe normal. Third breath. Hold it. And they continue with it. What happens if they go like this? I had an NBRC exam question I saw this morning, and one of the questions was this. Patient was going, taking deep breath with every breath.
To the
And-
ties.
Cannot reach into the lung.
Yeah, hyperventilate. What will happen when you hyperventilate? Tinkling, right? You'll get lightheaded. So if the patient, when the patient taking the breathing treatment, they complain of lightheadedness and the fingers, the tingling, then you know that you are hyperventilating the patient. Patient is taking deeper breath. You need to tell them to slow down and relax. The question was, and patient taking breathing treatment, complaining of lightheadedness and blah 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 blah, what would the respiratory therapist would do? The answer was tell the patient to slow down their breathing and relax. That was the answer. So I just threw that in there since I saw that question this morning. Okay, so you would instruct them to breathe normal. Every third breath, take a slow deep breath. So, middle of the treatment, what kind of assessment you would do? Okay. If the heart rate goes higher than a certain level, you would stop. Which level is that? 20%. Right. And if the heart rate is 80, now it's 99, would you stop the treatment?
No.
What would you do? Continue with the treatment. Monitor the patient. If it's 101, what are you going to do?
Stop.
Stop the treatment. Alright, so you continue with the breathing treatment, and after you finish the treatment, if you're taking a mouthpiece treatment, how are you going to tell them to breathe through the mouth or the nose? Obviously mouth. So, I mean, I have seen patients taking treatments, but this mist is continuously coming. That means they're not breathing in and out through the pipe, right? So they were breathing through the nose. So you tell them, remind them occasionally, breathe through your mouth, please, nicely. So after they finish with the treatment, what assessment you would do? 3 assessments. Heart rate, breath sounds, respiratory. Then what would you tell them? I want you to take a nice deep breath and cough for me. So you ask them to cough. And how do you instruct to cough? Not to just cough like like that. You ask them to take a deep breath. Forcefully out. Couple times. Okay? And if they cough up, you need to look at the sputum to see their color, consistency, and the amount. It's there somewhere. Yeah, baby. Yeah. Observe the sputum color, volume, consistency, odor. Some papers say smell this. Or taste it.
Yeah.
One student told me they're supposed to taste it. No way.
Just in case.
No, please don't.
And I was gonna tell him, I think we talked about it before, do not
Yeah.
smell it.
You can
If
smell
you
it if it's
notice an
Yeah.
obvious smell.
Yeah, don't smell it. We were joking about it. So, sputum color, consistency, and the amount. Okay, that's the three things you need to know. What if they say you looked at the sputum and it's thick yellow? What could be the issue?
Infection.
Yeah, it's an infection, right? And what if the sputum looks bloody? What is going on?
Like
Flooding.
sputum with blood.
Yeah.
Edema.
No, edema is pink and 14.
It's just pure blood coming out.
Yes.
They're bleeding somewhere, right?
Blood.
Yeah, TB.
Yeah.
Could be TB. Could be bleeding out in the upper airway somewhere. And if it's a large amount of blood, you need to be careful about. And if it's blood tinged, you need to notice, tell the physician, it could be TB, right? So that's the reason that you need to look at the sputum. It's extremely important. So after you ask them to cough and you look at the sputum, you would put the patient back just like you saw before. If they were laying flat comfortably, put them back to that same position. And you tell them, ma'am, we'll be coming back in another 4 hours, give you another breathing treatment. Your doctor ordered every 4 hours, so we'll be back around 12 o'clock and relax. We'll see you later. Close the door and go out to the chart. What are you going to chart? The last page. Time and date. Pre-treatment assessment. Post-treatment assessment. How well the patient tolerated the breathing treatment. And the color, consistency, quality of the sputum. Any adverse reactions and patient, and you chart that you educated the patient. All this information needs to be charted. If you didn't chart, what happened? You didn't do the treatment. They can get you in trouble. So you will need to chart, and the information for charting is all those things. For the next checkoff, we expect you to tell us what I just told you. The time you see the order, what are you going to do? First thing, you go to the chart and look at the information, look at the medication, all those things. Then you go to the room, introduce yourself, identify the patient, do the assessment, have the patient sitting up, give the treatment, do the assessment again. At last, you ask the patient to cough, look at the sputum, and all that. Then you come back and chart, and your treatment's done. So you need to know that steps, and the steps is right here, clearly written, step by step. Just look at that. That's all you gotta do. I just showed you how to do the mouthpiece. Let me just show you. We expect you to know these things too. You walk in the patient room to do a breathing treatment, but the patient is on the ventilator. How do you do the treatment? You can't do a mouthpiece, obviously, right? Okay.
Oh,
Okay, this guy is on the ventilator. What we do is, we usually leave one of these guys in line with all the patients, ventilator circuit. On the inspiratory side of the ventilator circuit, we put an inline T adapter. We leave it there. Okay, I'll show you how to do it. This is the inspiratory side of the ventilator. You don't need to learn anything else. Just remember inspiratory side of the ventilator tube. Okay. It stays there like that. Okay? It's there. See, when you walk in the room to do the breathing treatment, let's say this patient's been taking treatments before. It's already put together as in the bag. You pick up this, you put your medicine in here, right? And you take this inline T, open that up, stick it in there. It's already hooked onto the oxygen or air. Turn that up. See that? Treatment's going. About 10 minutes later, you go in there and turn that off, take this off. Put the cap back on.
So that's the experts on.
What's that?
On
no, it's the inspiratory side.
inspiratory side of the tubing.
So,
Don't
it
worry.
so when it breathes, it comes out the other side?
This is expiratory side.
Oh.
Patient getting
I
the
had no
air
idea
through
about
here. Patient getting through the ventilator, air coming through this side, going in the patient, exhaling out through here, and out through the ventilator. Out.
So
It'll be
does it
marked
have a
on the
valve?
ventilator.
Hmm?
It'll be marked on the ventilator which side is which.
Yeah, yeah. You will learn that later on when you learn ventilators. We'll show you all that stuff.